Hey, this is T-Band. My topic today is going to be, well, first I'll talk about teeth a little bit. And from my estimation, what causes teeth decay is not the presence of germs on a person's teeth. Okay, so let me go into that. First off, the new germ theory of disease is that helpful germs grow where they are needed most. So, if you have germs on your teeth, it may be that they are helping. Now, how can they help? Well, two ways. First off, they may actually help with being a infrastructure which builds your teeth. And I can think of one mechanism for that, possibly more. But your teeth do apparently have stem cells in them in various locations, maybe up to 5 different types, um, in and around the teeth. So teeth do regenerate. As far as I know, that was shown by um, Weston A. Price in the early 1900s, where he took young people, I guess children, that had cavities in their teeth and took x-rays of the cavities of their teeth with the cavities, and then changed their diet. Now, back in those days, if people lived in the city, they may have had really bad milk from cows that were fed um, grain or grain slop from nearby breweries, like the barley uh, after it has been used in making beer. And also, so these cows did not eat grass, but then also um, these early city dairies were pretty bad smelling places, and the animals did not get good nutrition. Now he switched their diet possibly to whole grains rather than white bread, and he also had them drink, I believe, unpasteurized milk and maybe milk from grass-fed cows. Okay, the fat of cows, and there's a lot of fat in milk fat. It's like the cream. Butter is made from cream of cow milk, and butter's certain or cream is a certain amount of fat, and cream is agitated when making butter until the fat separates from, I believe, the buttermilk, possibly, and you have butter begin to um, form from fat particles sticking together and then attracting other fat particles out of solution, out of the um, out of the cream, which would be kind of a colloid. That's a chemistry term for a fat or anything in particles in floating in solution. And butter tends to be yellow, and butter from grass-fed cows tends to even be more yellow and green, almost like the color of the grass. And the fat of grass-fed cows is different from that which is fed corn, a different kind of corn than maize that you get from the grocery store. Um, I believe it's called dent corn or something that the cows are fed. And corn has omega-3 fats, whereas grass has I'm sorry, the other way around. Corn has omega-6 fats, whereas grass has omega-3 fats. Um, you've heard of fish having omega-3 fats. That's wild fish that are not fed corn, that are not uh, in ponds and fed corn. They're wild fish that eat plankton, which is almost like grass, and has the omega-3 fats. And so the fish incorporate that into their body, and they have the omega-3 fats. When you eat or drink cow milk or eat butter, you're either getting omega-6 fats as a tendency, or omega-3 fats, depending on the cow's diet. And that will incorporate into your body. And it's good to have a good balance of omega-3 and omega-6 fats. And people today have more omega-6 than omega-3, and the ratio is out of balance. Possibly you should have equal amounts. I've heard that omega-3 is anti-inflammatory, whereas omega-6 is pro-inflammatory. And we're talking about whole body inflammation. So if you were to have an injury is often called an acute injury, like a sprained arm, wrist. It will swell and you'll have inflammation. Well, they can look for markers in that region and find there's inflammation markers and inflammation. Okay, so full body inflammation, though, is when your whole body has those molecules, or those maybe inflammation factors, and you can find that in chronic inflammation, whole body inflammation. You find those inflammation markers in the whole body, as if you're undergoing inflammation at all times, just generalized everywhere. And that can be bad for as a continual thing for continuing health, or for some kind of health, ongoing health. So Weston A. Price switched their diet and then x-rayed their teeth after switching their diet to better foods, and found that the cavities had reversed. Now, your teeth have a core part that is pulp, and outside of that is dentin, and then outside of that is enamel, just as a general transition from the center to the outside. The core is supplied with blood by blood vessels coming into the tooth up through the roots of the teeth. And if you have a full tooth, and you look at the bottom of it, where it fits into the jaw socket, it has a pinhole that is where blood vessels lead up into the tooth, and there's blood vessels leading out. There's also lymph vessels. Now, blood circulates in the blood vessels from the heart through the arteries, and then to smaller arteries, maybe arterioles, and then at the tissue level into capillaries. From the capillaries, it leaves the blood vessels and goes into the tissues, and then a little further down the capillary, it comes back into the capillary, and from there goes into small veins, perhaps venules, which lead back to larger veins, and then back into the heart. The lymph is different in that it's almost like the roots of a tree. It branches everywhere into all your tissues, and it's just only drawing water and lymph fluid from the tissues, and it's continually drawing from the tissues water out of them. If your lymph isn't draining the water out of your tissues and pulling it out of your tissues, you'll have swelling of the tissues, which is called edema. And if you've ever seen someone with edema legs or arms, legs and arms are called extremities. There can also be whole body edema, like in the belly region. But the edema in the tissues, it's interesting if you push down on it with your finger on the skin, it'll leave an indentation for a little while, almost like memory foam, as the water is squished out of the tissue, and then it retains that indentation until the water comes back in. And the lymph drains that and pulls it out. There are also cavities in your chest and stomach area, I guess your chest and your abdomen area, that that can fill up with lymph fluid if it's not draining properly by being sucked up by the lymph vessels. And your internal organs are kind of interesting, like your heart or your lungs or your intestines. They're almost packaged with as if by shrink wrap, by a membrane, and these membranes excrete serous fluid, which is like blood serum, but they also draw up the fluid, and this allows for lubrication and sliding. And the heart is almost shrink wrapped with a membrane, and then the lungs and the intestines, and then all these shrink wrapped organs are themselves shrink wrapped with a larger packaging. And this allows for free movement of your body when you twist your torso or bend forward or backward, and a little bit of liquid on the membrane allows them to slide freely. So that's a little bit about the lymph. Also going into your teeth, besides blood vessels and lymph vessels, are nerves. And when you have a toothache, sometimes it's because the nerves are exposed to the outside of the tooth. Maybe you have a broken tooth, or you have a tiny fractures or channels leading into the pulp area of your tooth where the nerves are, and your teeth can become sensitive to hot and cold, or perhaps to pressure, or to sugar and sweetness. So your teeth have blood flowing in and out, and that kind of gives them life, and teeth are able to regenerate. Now, I have an idea that there's a electric potential set up between the outside of the tooth and the inside of the tooth, where the pulp is, that has a electrical charge difference, possibly a negative charge inside the tooth, more so than outside the tooth. So it's relatively negative, and this will attract positive ions. Calcium is a positive ion when it's in solution as Ca2+. So also is sodium, Na+. Sodium is its chemical name is natrium, and that's why its chemical formula is Na. So calcium is a component of your teeth. Your teeth are like crystals, and crystals can grow. So if you've ever seen sugar crystals grow, like rock candy, or if you've seen these little rocks that you grow crystals in, crystals can grow. And since your teeth are crystalline, they can grow and repair. And it may be that a negative charge within attracts positively charged calcium to build your teeth. And this may also occur with the bones in remineralizing them. And your saliva has minerals in it including calcium, I believe the main component or main structural component of your teeth as a crystal is calcium phosphate, which as a crystal would be both positive and negative. Calcium positive, phosphate perhaps negative. But drawing calcium down into your teeth could attract the phosphate as well, and to rebuild them as a full crystal with both components. Now, your teeth have bacteria on them, and it's said that when you eat sugar, these bacteria, or any food perhaps, these bacteria convert sugar into acid. And they use the sugar for food, and one of the byproducts is acid. Well, when you eat food, you may have an acidic environment for a short period of time after eating, but your saliva is not acidic. It's actually basic or alkaline, and with time, your teeth will quickly return to an alkaline state. But while the acid is there, it may actually perform a good function for your teeth to regenerate. Now, you have channels leading from the outside of your teeth to the inside, which are tiny microtubules. And the microtubules could be the channels through which calcium is drawn down from the outside mouth environment where the saliva is, and this assists in rebuilding the teeth from the outside in. Okay, and an acid wash every once in a while might be a good thing, in that if the microtubules are blocked or covered with enamel or crystal mineralization, then an acid wash could etch them and etch that surface layer away, open up those tubules so that repair can happen as minerals flow into your teeth from outside. And we have micro fissures that occur in our teeth through everyday use, just the common eating and biting onto things can stress your teeth and make tiny cracks and fissures. But if minerals desire to flow into the teeth because of the electric potential or electric potential difference from the outside to the inside, where there's a charge difference, it may be that having a microfracture is quickly repaired by the teeth or in the teeth by minerals flooding into this new fissure or crack and welding it back shut, perhaps stronger than it was before the crack happened, as long as you have blood flow to your teeth, supplying that electrical charge. Now, blood flow, and here's where my theory of a large, perhaps the main reason for teeth decay, is that blood is not flowing into people's teeth because their teeth are not seated in their sockets. So the jaw has round, almost cone shapes, which the teeth fit down into, and the teeth are anchored to the bone of the jaw with many, almost like little wires or fibers, and it's ligaments. So it's a protein structure, and ligaments anchor your teeth to the jaw. And when you have a loose tooth, perhaps you have some of those ligaments broken. Although I believe ligaments can grow back and reform connection. Now, if your teeth have sunk away from their socket, then the blood vessels to the teeth may be stretched, also known as attenuated. They may be stretched thin so that there's not sufficient blood flow. And if you've ever seen x-rays of teeth, it seems like, especially the back molars, are leaning forward to the front of the mouth, and they're not seated in their socket vertically like they should be. And for that reason, there's not sufficient blood flow. And having your teeth straight and seated may be a very important necessity for having healthy teeth that don't get cavities and that repair from cracks and other and stress. Now, teeth will seat better in their socket if they're challenged, and if a child has a bad bite, which is a technical term for not having straight teeth, that maybe they're all too closed in and not wide and well spaced. If the child eats carrots, a carrot, let's say, for lunch every day, a raw carrot, then that may improve their bite and straighten their teeth naturally. But also a major component is missing from bread these days, and that's fiber. If you eat whole grain bread, you'll be getting the fiber. Now, fiber is non-compressible, so if you imagine tissue, toilet tissue is, or a napkin, that's fiber, and if you bite onto it, you'll notice that it's non-compressible, and it's fairly hard when you bite onto it. It doesn't squish away. And having fiber in bread will jar your teeth into their socket, especially as a piece of fiber gets between any two teeth, upper and lower, and it comes between them at their grinding surface, and you bite down on it. Then if the fiber's there, it will provide a space that the teeth can't compress, and the teeth will be jarred up and down back into their socket. And as you eat bread regularly and get fiber regularly, you'll have this seating of your teeth. So there may be more that germs and bacteria on the teeth do than just acid wash your teeth. They may actually provide nutrients or direct the healing process of your teeth. That's not outside the realm of possibility. But let's talk about one other important reason for having bacteria on your teeth. Now, nobody wants bad breath, and it's thought that bacteria produce bad smells, which is true. Like if you've ever had a broken tooth, that bacteria, if food gets down into, the bacteria will work on that food and it will smell bad or taste bad. But as long as you don't have food accumulation, that particular situation won't occur. And bad breath or even body odor, there may be a better way of mitigating that than removing the bacteria from your teeth. Possibly a lot of the bad smells, either from the teeth or under the armpits, come from the elimination of toxins by the body. And you can see if you're chewing and there are toxins brought to the gums under the teeth, then chewing will pressurize that area and squish the toxins out into the food that you're eating. And then you'll swallow those toxins, and as long as, especially if you have fiber in your diet, the toxins may be set up as they're released by your body and by your mouth to bind to fiber and be carried all the way through your body, because fiber does not digest. It goes all the way through your digestive system and is eliminated in your dung. And fiber is important for digestive health for that reason, for toxin elimination, but also for assisting in bowel movements and having a regular movement of food through your body. The fiber is important in getting the intestines to move food along through your body and prevent blockages. There's also, since we're talking about toxins, when you eat anything, the liver, which purifies toxins out of the blood, dumps toxins into your food just past the stomach at the beginning of the small intestine. It may be called the duodenum area between the stomach and the small intestine. And if there's fiber in your food, or gelatinous foods like maybe aloe vera or cactus or okra, these are gelatin type foods, the fiber or the toxins will bind to that, and that's good for toxin elimination from the body. Bacteria on your teeth survive by consuming some small fraction of the food that you eat. And there are many different species of bacteria that we come across in our environment and every day, and that live in our mouth. And when you eat food, you may have different people may have a different type of diet that they tend to eat, some more sugary than others, or otherwise more fatty. Whatever your diet is, the bacteria on your teeth that are best adapted to that diet will be the ones that survive and thrive and grow in large portion on your teeth. Now, this is important for digestive health, because when you chew food, some of those bacteria are rubbed off into the food through the abrasive action of chewing. And this bacteria, some of it survives the stomach acid and makes its way to the small intestine, and it's well mixed into your food, and it starts digestion, because a lot of digestive action is actually bacteria enveloping or consuming the food you eat and metabolizing it, breaking it down, and releasing it. If you do not have bacteria in your gut, your dung will be white. And some people that are on chemotherapy or radiation treatment perhaps have lost their gut microbiome, and that's a condition that they have. Bacteria on the teeth may be good for digestive health, and one support of that is it seems that there is a connection, and you may want to research this by doing a search for it. Is there a connection between diabetes and the use of mouthwash? Now, mouthwash may have bad chemicals in it that are harmful to your body, but that's not necessarily what contributes to the diabetes. It may be that mouthwash contributes to diabetes precisely because mouthwash is effective at doing what it claims to do, which is kill bacteria on the teeth. And without that bacteria and without that jump start of digestion and having bacteria mixed into your food when it's digesting that are well suited to that food, you lose the benefit of that bacteria in metabolizing and consuming your food. Now I don't know since having seeded teeth and straight teeth is important in my idea of dental health and regeneration and teeth being tough and resilient. I don't know the best way to seat your teeth. It may be that teeth straightening through a dentist is a good thing. I'm not sure if they do a good job at seating your teeth up in their socket or aligning them where they need to be. But challenging your teeth by eating food with fiber will likely contribute to getting your teeth where they belong and where they should be. If you have a missing tooth, like you've had, it may be that teeth lean into, and it is that teeth lean into where there's that missing gap. And that will stress the blood vessels to the teeth that are leaning away from their socket. And so placing some kind of gapper there, some kind of a replacement tooth or tooth spacer may be a good thing. And I'd actually like to see the ability to take a person's mouth at whatever state it is with the teeth and don't get rid of any teeth that are there, but seat the teeth that are there and try to have them heal as best they can, and then all the gaps put in a plate of teeth to fill in the gaps. And that would be a real nice thing. And they may do, modern dentistry may offer that. I don't like the idea of getting a root canal where the root canals of your teeth are cleared out with a file and then a rubber, like a rubber plug, and I believe that's called perchia rubber, something like that. Gutta percha, I believe, is inserted down into the root, almost like a spike of rubber, to prevent blood vessels from regrowing into that area, and then the tooth is filled with some kind of cement or filler, and then capped with it a harder outer surface material, or artificial tooth material. And I don't like to see people lose the root of their teeth and that inner core, because then they lose the ability of their teeth to regenerate once they do get them straight and have a good diet that's supplying the things their body needs to best regenerate teeth. So I recommend, if you can stand the pain, usually a toothache will go away within a month as the tooth, perhaps the nerves of the tooth sensing pain and pressure will stimulate a growth of denticles to cover the pulp and protect it from pressure. Dentists who do root canals oftentimes see denticles that have formed that block their view of the root and make it difficult for them to access it. And denticles are like enamel that is grown within the tooth somewhere. Uh, Almost maybe like an oyster uh, putting a pearl coating around an irritant within it. So I recommend not having your teeth pulled if at all possible. Even if a dentist drills into your tooth and says, "Oh, I drilled too far and the cavity's gone too far and we're going to have to pull your tooth." If you've got a tooth of any kind and it has blood flowing into it and pulp, stop right there and save that tooth and and leave it alone and find some way to either wait for dentistry to improve where you can have your tooth restored, or let your tooth restore itself. And teeth straightening by a professional dentist may be a good thing, or there might be some home way, do it yourself, of straightening your teeth and pressurizing them back into position where they belong, either by clenching your teeth or by perhaps biting at different angles, like holding your bottom jaw out and then biting down, or to the side, like that, or at different places, and just doing that regularly. That may help in placing your teeth in their sockets. And there may also be a time factor, since teeth are held in place by ligaments. Ligaments will stretch, and they'll have different stretching rates depending on the pressure that's put on them. Some things you can put too much pressure all at once and they'll snap, or some things you can put just the right pressure and they'll gently release and stretch. Or if the ligaments are connected to the tooth or to the jawbone, to the socket, once one end of the ligament may release, almost like a stamp being released from an envelope. Sometimes when taking a sticker off of something, you have to pull it very slowly if you don't want to tear the cause tearing at the bond. If you want the bond to just simply release, there's a proper pressure and rate at which to do that. So I'm sorry that I can't offer more advice on best ways to do it yourself. Seat your teeth. But now that the idea is out there, hopefully nobody damages their teeth in developing a system, but hopefully that there will be some efforts made to effectively seat your teeth with easily accessible tools or materials, perhaps even a folded piece of paper. And as far as body odor, I've heard that eating parsley or ginger helps with that. And at one time, hospital patients in open dorm hospitals where there are many beds on one floor, the patients are in bed for a long time and they begin to smell. The hospital would give them chlorophyll to drink. And the chlorophyll helped with removing and eliminating body odor. So getting parsley or other greens is is good for that reason. You're probably getting chlorophyll, and it's probably helping with minimizing odors. So parsley, ginger, maybe something else. Maybe any greens, maybe lettuce. Well, I've used a dental pick before, and my teeth were not straight. They weren't seated well, and this dental pick, I pushed it in and out between my teeth at the gum, and it had a kind of a rough surface a little bit, and right here, and also down here on my bottom jaw, um, there was micro fissures that did not repair. Perhaps because my teeth were not straight and were not getting sufficient blood flow. So I would caution being careful with dental picks and abrading the surface of your teeth with them, and also stressing them if your teeth are not resilient against stress and micro fissures and cracks.